Hi, our ethical dilemma is on opioid usage and Narcan administration. Opioid overdose can become life-threatening within minutes because they can slow or stop a person's breathing. Narcan is often given in emergencies to reverse the effect of an opioid overdose and save the person's life. However, ethical concerns may arise when a patient has an advance directive such as do not resuscitate or DNR. In these situations, healthcare providers must decide whether giving Narcan supports or goes against the patient's previously stated wishes. This creates a challenge between respecting the patient's autonomy and acting in the patient's best interest. Patient autonomy means individuals have the right to make decisions about their own healthcare. As Haley et al. 2021 stated, patients have the right to make their own decisions, which must be supported by nurses. Nurses play an important role in these decisions by advocating for the patient, reviewing the patient's wishes, and following ethical and legal guidelines. Careful communication and critical thinking are necessary to ensure decisions respect both patient rights and patient safety.
Opioids are commonly used in healthcare to manage moderate to severe pain. One major advantage is that they provide effective pain relief and improve patient comfort after surgeries, traumas, or treatment. The use of opioids can help patients participate in rehabilitation and recovery activities that they would not be able to participate in if they were in immense pain. According to Morin et al., opioids are especially valuable in critically ill patients when adequate pain control is necessary. However, opioid use also has several disadvantages. In addition to an increased risk of respiratory depression, which can be life-threatening, there are common side effects like nausea, constipation, and sedation. Prolonged opioid use may lead to tolerance, physical dependence, withdrawal symptoms, and opioid-induced hyperalgesia, which is an increased sensitivity to pain. Improper or excessive opioid use can also contribute to adverse effects. Narcan, or naloxone, is used to quickly reverse opioid overdoses by restoring breathing. According to Sari, Strang, and Dale, it is the first-line treatment for opioid-induced respiratory depression and has a strong safety profile. Another benefit is that it has little to no effect when opioids are not present, making it a relatively safe medication to administer in emergency situations. And its widespread use has contributed to reducing overdose-related deaths. Despite these benefits, naloxone does have some limitations. Narcan can precipitate withdrawal symptoms in patients who are physically dependent on opioids, and since its duration of action is shorter than that of many opioids, patients may require repeated doses and continued monitoring because respiratory depression can occur. In addition, naloxone may reverse analgesia, which is the inability to feel pain, causing post-operative or chronic pain patients to experience a sudden, unbearable return of pain.
Our group strongly believes that Narcan is an essential life-saving tool when it comes to intervening during an opioid overdose. In an emergency situation, acting quickly by administering Narcan is absolutely the right thing to do to prevent tragedy. However, our argument goes beyond just emergency response. Simply making Narcan widely available without any structured rules or framework doesn't actually address the deeper causes of the opioid crisis or addiction. Because of this, we believe in strict regulations. We believe Narcan should be administered under proper medical supervision alongside comprehensive monitoring and education by introducing these regulations. We can protect the patient's safety and honor patient autonomy, especially when dealing with complex situations like advance directives. Ultimately, regulation ensures that Narcan remains an effective emergency tool rather than just a temporary patch on a much larger societal and medical issue.
Hi, my name is Cassidy Johns, and I will be speaking about the rationale for our group stance on Narcan administration. Our group stance on Narcan administration is supported by the Nursing Code of Ethics as well as Arizona's Nurse Practice Act. Based on the Nursing Code of Ethics, nurses should administer Narcan to patients in need. Provision 1 of the Nursing Code of Ethics requires nurses to treat every patient with compassion and respect. Nurses should provide care, keeping in mind that every patient is worthy of life and care without stigmatization. This provision specifically speaks to how nurses should care for patients with substance abuse disorder. If a patient is experiencing an overdose, nurses should administer life-saving medications such as Narcan. Provision 2 of the Nursing Code of Ethics states that the nurse's main responsibility is to the recipient of their care. When a patient is experiencing a life-threatening opioid overdose, the nurse's obligation is to preserve the patient's life, giving them a chance to seek help in the future for their opioid use disorder. Arizona's Nurse Practice Act is composed of Arizona's revised statutes and the rules of the Arizona Administrative Code. The Arizona Administrative Code allows nurses to administer life-saving medications in emergency situations. Administering Narcan during an opioid overdose qualifies as an emergency. Arizona Revised Statutes 36-2267 authorizes nurses to administer Narcan, educate patients on opioid use disorder and Narcan administration, as well as distribute Narcan to patients at risk. Thank you.
My name is Brianna Osterman, and I'll be discussing the rationale for group stance on Narcan as well, but specifically regarding patient rights. Patient rights connect directly to Narcan because all patients obviously deserve equal, respectful, and life-saving care, even if their condition is related to substance abuse. The patient has the right to withdraw from any treatment, and our patients should not be subjected to abuse, neglect, coercion, manipulation, sexual abuse and misconduct, or assault and restraint. Arizona Law Code R9-10-1208 explains that patients have the dignity and respect to not be subjected to this. In an opioid overdose, Narcan supports these rights because it gives the patient a chance to survive care as well. Peer-reviewed evidence also supports Narcan access. Fisher et al. Found that community-based naloxone distribution programs can actually help prevent these opioid deaths as well. Patient rights do protect the ability to receive the medication, grant immunity for those who decline and are competent enough to say so. And research also supports naloxone access because it helps prevent opioid overdose deaths when given quickly. And education on this also improves confidence for us as providers to respond during an overdose emergency. It respects patient rights because patients are given emergency care that prevents life, dignity, and good treatment as well. This overall supports our group stance because we believe that Narcan protects life, promotes equal treatment, and gives patients the opportunity to make future decisions about their health.